Hello and welcome back to our channel, Budget Longevity, where we look at the current research in longevity and in ways to incorporate the best interventions at a reasonable cost to expand your health span and lifespan. Today, there was an article published in Science Journals by Eric Topol. Eric Topol is a cardiologist who recently published a book called Superagers. The article was called Predicting and Preventing Alzheimer's Disease. It noted that at present we may be able to predict the development of Alzheimer's disease up to 20 years prior to clinical diagnosis. This is through blood markers, particularly p-tau217, which is now available through Quest Labs. I believe you can order that yourself. I've been trying to find the cost because it will most likely be self-pay, but I'll update that later. I posted a comment on his Twitter, which is now X, and discussed my budget longevity recommended program for preventing Alzheimer's disease. First, of course, is the basics: diet, exercise, sleep, and personal relationships. The diets that are most closely correlated with preventing Alzheimer's are the Mediterranean diet, the DASH diet, the MIND, M-I-N-D diet. But if you are really a fan of the carnivore diet and the high protein diets, as long as you monitor your LDL cholesterol, there's no study that shows that diet is definitive. So you can do whatever diet you want. I mentioned supplements, which are still controversial. You can look all those up. There was some recent studies showing a multivitamin such as Centrum Silver and some of the multivitamins that are directed at memory preservation have been shown to reduce the risk or the progression of Alzheimer's disease. I suspect those studies were published and paid for by the manufacturers. So in that case, I have some questions, but it would be reasonable right now to take a multivitamin until we know more. The medications I think have shown the most help in preventing or slowing down the onset of Alzheimer's disease include rapamycin, Zetia or ezetimibe, any of the statins such as Crestor, Lipitor, or Peter Attia's favorite, pravastatin, and my secret ingredient is Viagra or sildenafil or Cialis. We can go through the studies, we'll probably do that later, but the most impressive study was a 70% reduction in Alzheimer's disease in people taking Cialis or Viagra versus people who did not. This study was just in men, because generally women don't take Viagra, but I've been suggesting men and women take Viagra, either Viagra 20 milligrams once a day, which is sildenafil, or Cialis, tadalafil, 5 milligrams once a day for the prevention of Alzheimer's disease. Both these medications increase nitrous oxide, which is a critical component in blood flow, vascular health, and brain functioning. They increase cerebral blood flow, and there were some studies showing that they reduce or remove amyloid and tau proteins in the brain. More definitive studies are ongoing, but I don't plan to wait around to find out. I think these medicines are going to show definitive reduction in dementia based on their animal models and early research. Since this is a budget longevity channel, I want you to note that you can get Zetia or ezetimibe, a statin, and either daily Viagra or Cialis, all for less than $10 a month. The rapamycin, which has been shown to reduce the progression to Alzheimer's, particularly in people with ApoE4 genes, which we'll talk about later, and you can look all that up. But rapamycin, I was able to get 90 pills of the 2 milligram for about $250 3 or 4 months ago. And since you only take 3 tablets a week, that's almost 3/4 of a year. But they've had a price increase recently. The 2 milligrams for the same number were like $1,200. And even 30 pills of the 1 milligram, which would be 6 per week, is about $60, which is still reasonable. You're talking about $50 a month for 6 milligrams per week. Again, you must shop around and use the GoodRx card. Some pharmacies are charging $1,000, some are charging $60. So if you shop around, you can, on your budget, find these medications. Diets are free, basically, and you can get good quality generic multivitamin and do all those things until we have more definitive medications to extend longevity and prevent Alzheimer's. But for right now, this is the best we have, so I recommend it highly. Thanks for watching Budget Longevity, and we're trying to get you through to the next phase when we'll be extending lifestyle. There's some amazing things coming down the pipeline. The problem is they're all going to be expensive, and we're going to keep you on a budget. So thanks for watching.